Thank you, ladies and gentlemen. I am more than happy to be with you on this special occasion because I know that now in your country you have a very special situation with medical cannabis. So to be reintroduced as a medicine, and I suppose this is a just honor to be with you in this particular moment. And I'm very grateful to Lucy organizing such an event. Thank you very much again. I would like to share with you some of my experience as experienced Israeli psychiatrist and physician in the field of medical cannabis. So in the field of cannabis as a treatment for various disorders. I would not to speak more about the history because you already had a lecture of Professor Lester. But I would like to describe some medical moments within the cannabis treatment, describing the patient-doctor relationship, sometimes very complicated within the cannabis treatment course. And we will discuss how you should talk to your physician, how you could explain them your symptoms, and how you would expect from your doctors to provide you some advice how to use cannabis as a medical treatment. There are some topics I would not like to discuss here. First of all, this is a decriminalization of marijuana, as well as legalization of cannabis. I suppose this is a social issues, and they should be solved between policymakers, public, and this is not medical topic we should discuss here. Also, I would not like to discuss how would cannabis impact on teenagers and adults, because majority of you just imagine what kind of impact there is. Also, we would not like to discuss some issues how to detox cannabis-treated patients. This is not topic of my talk. I'm also a fully independent physician. I'm working only in private practice, so I provide you unbiased access to some cannabis topics. And again, we should begin from Professor Lester. Now you had it. You had a lecture from his personally, but this is my first slide because he is a pioneer of this field, and we should appreciate his effort. And we had a good lecture with interruptions, but his invent to this field is just anonymous. I would like to cite him from one of his first papers, saying that cannabis as a substance is very, very safe substance. So it should be used widely for medical purposes, and we should put it much widely for our medical practice. The ethical issues that I would like to discuss appear some years ago in the paper. I'm sorry for this busy slide, but some topics from this already presented by Professor Lester, saying that since 1937, cannabis was just demonized and criminalized as a substance. And we doctors lost any possibility to use it for our everyday practice. It could be obtained only from black market, from drug dealers, and we lost very potential medication for 80 years, and I suppose it should be stopped. Also, I would like to show you this is very known Schedule 1, Schedule 2. You see from the Schedule 1, marijuana appeared just after the heroin as a highly potential for abuse and very dangerous medication, very dangerous drug. The situation is described by the Professor Ginsburg is absolutely awful. And unfortunately, it continues till now. Till now, in your country, in the USA, in Israel, and many other countries, they simply are not ready to reschedule it, and should be done as soon as possible. For example, it is suggestion to put it in Schedule 2 as a medicine that could be used for medical purposes. But also, I suppose that it should be used for the Schedule 3, like Ritalin, methylphenidate, that using frequently for children with attention deficit and hyperactivity disorder. I suppose that cannabis is much safer than Ritalin, like methylphenidate, and should be rescheduled not as a Schedule 2 drug, but as a Schedule 3 drug, also controlled, but but without any legal penalties for the users. Also, I would like to say you that NIDA, National Institute of Drug Addiction, just suspend majority of studies for 80 years, do not allow for any physicians to use it for medical purposes and for research purposes. So we just lost about 60 years, between 80 and 60 years for medical research in this field. And now it announced there is no scientific base for such practice. It is just hypocrisy. It should be stopped. We should use much more. We should use much more cannabis for various research. For my own research, I'm working in the field of neuropsychiatry. So it was just impossible to do such research. Even now, in many countries, in Israel, we have a very limited situation, and we can do some research for some particular obstacles. It should be changed as soon as possible. For policymakers that are supposed to be here and in other countries, there are some suggestions for the medical marijuana law. So it should be done. Medical marijuana should be in law as a valuable medical substance. We should not prevent our patient to obtain it legally under the prescription as a controlled substance, but patients should have access to this medication. You could ask what kind of healthcare professions are eligible to advise patients to use about marijuana as a medical substance. First of all, it should be any physician that have good knowledge, unbiased and objective knowledge, should have right to advise patient the cannabis as a medicine. I'm also think that pharmacists that could be provided much better knowledge than now also could advise patients to have a cannabis as a medicine. Unfortunately, 4 generations of the doctors and pharmacists and nurses were brainwashed and we never studied it as a medical substance in our universities. I remember myself as a medical student, as a young resident, as a medical doctor, as a specialist. In all my years of education as a healthcare practitioner, nobody told us that cannabis could be valuable treatment options for any patients. Just said this is a dangerous medicine, dangerous drug, you should avoid it, and you should try to get your patients out of cannabis as far as possible. This is, I suppose, the main obstacles that's staying on the way of cannabis as a treatment potential. This is the attitudes of medical community. Until the medical community in all of the world will change their attitudes towards the cannabis as a valuable treatment options, nothing will change. So I suppose that in your country, like in my countries, like in other countries, the attitudes of the doctors are the main reason that cannabis now staying where it's now. And it could be obtained only from black market for limited purposes for 6 countries that legalize it for medical users. It's just impossible. 6 countries could now have cannabis as a legal medical substance. Only 6 countries. And I don't know I have not exactly know the situation in your country. I suppose it's not legally, officially appreciated as a legal medication in Australia. But the situation that only 6 countries in the world have medical cannabis available, it's just impossible situation. Another question, what condition that medical care professional could prescribe, what kind of information he should obtain from patient, and what kind of information we should collect from them in order to be sure we prescribe the medicine in the proper way. I suppose we should listen more to our patients. So-called evidence-based medicine is just out of time, unfortunately, because the evidence they gained from very small proportion of the patients in the randomized controlled trial do not fit the real practice. I suppose we should just change our practice from so-called evidence-based medicine to practice-based medicine, to be more patient-oriented. We should listen more carefully for our patients, what helps them, how helps them, and learn more. When I was first introduced to cannabis as a medicine, it was for my post-traumatic stress disorder patients, Israel veterans of our, security forces. They told me, okay, I use cannabis as my medicine. It was very hard to me to believe them. And I learned from one case, other case, many other cases. I learned from them. They just under self-treatment. They found their own medication, and they have a real alleviation of their nightmares, repeated thoughts about what happened with them. I suppose that it really changed my practice. I switched slowly from conventional neuropsychiatry to cannabis-based neuropsychiatry. Another question, what kind of condition we could advise surely cannabis as a treatment? First of all, as it's already introduced to you, it's oncological disorders. And in my opinion, also, it should be advised more frequently to various neuropsychiatric diseases. I have a great practice in Israel for the last 5-6 years with various neuropsychiatric disorders, such as Alzheimer's disease, Parkinson's disease, Tourette's syndrome, and post-traumatic stress disorder syndrome. There are many other disorders, such as pain disorder, glaucoma, and we suppose that in glaucoma we have no studies. In Israel, we have glaucoma is allowed to be prescribed cannabis. I asked how many patients applied for glaucoma for the last 5 years. Only one. What happened? Why? No physician just advised to use cannabis as a treatment for glaucoma. It is not the fault of the patients. This is a fault of us, of healthcare providers, that we have absolute cannabis illiteracy in this field. We just need to learn much more how to use it, because the government is much wiser. They put glaucoma on the first place, just after the pain medicine, just after the cancer and nausea, they put glaucoma. And only one prescription in 5 years in Israel. How it could happen? It's just because of the reluctant attitudes of medical community. And I suppose in other countries, the situation is the same. Also, there are other indications. I suppose there is no indication for cannabis. It is much wider than any particular indication could be suggested. It's much wider. So I could not say we have more than 2,000 orphan diseases. How is it possible to list all of them, saying if it's suitable for cannabis or not? Majority of the disorders are not studied well. So I suppose that patient who found his own medication and he is ready to be under medical treatment should be prescribed cannabis. Should be prescribed cannabis under some conditions, but we should not prevent him to obtain this medication. There are some ethical rules that could help us to build better relationship with the patients. In my practice, I listen carefully what patients supposed to do with cannabis, how frequently he use it, in which kind he use it, what the doses, how he obtained it, what the quality of this material, and who supply to him. Unfortunately, till now, the majority of the people coming to my clinic, they obtain cannabis from the black market. And I tried to take it from under the table, to put it on the table, and to apply for the license for such patients. Unfortunately, only between 10 and 15% of our recommendations are getting a license from our Israel Medical Cannabis Authority. This was the main reason that I just declined the suggestion to be a head of this authority, because I did not want to be a clerk and to refuse to 85% of patients to gain their medicine. I suppose this is a shame for our authorities. They just decline 85% of applications made by us physicians. I am coordinator of Israel Forum for Medical Cannabinoids. We have about 150 doctors regularly recommending cannabis. The majority of us are very frustrated. We have a refusal for 85% of our applications. Why it could be done in this country that suggested to be the leader in the world in the number of licensed per capita. We have now we have about 15,000 licensed patients in Israel for 8 million population. So we are leader in the world on the number of licensed, but the need patients to treat with the cannabis is much more. I suppose about between 100,000 and 200,000 patients could be really placed on cannabis till now. And it did not happen because of reluctance of medical community and newly established medical cannabis authority. So I suppose in your country, when you will build a new system of medical cannabis and you will build an Australian authority for medical cannabis, you should learn from our mistakes, the mistakes of Dutch Office of Medicinal Cannabis, from Health Canada that also had many mistakes and now changed their system. So you have good examples and bad examples. I suppose you could really, like your Prime Minister said, to have a best system in the world. So you have just this opportunity, and this is why I'm here, in order to help you to build probably the best system in the world, giving an opportunity to any patient in Australia to obtain his medicine freely, without any obstacles, but under the medical surveillance. I suppose this is our duty as doctors. Also, I would like to show this slide I obtained from one of the sites of patients' organizations. I suppose that you should create your cannabinoids patients association in Australia. You could have many other associations. For example, Americans for the Safe Access. I suppose they have the best website. It should be done in Australia, because without patients' advocacy, it will not go further. Doctors will not help you. This is my opinion. Doctors never will help you to access your medicine. Doctors just backward. They are very reluctant, and I suppose you should move forward to create your Australian Society for Medical Cannabinoids as a patient advocacy organization, and you should learn how to talk to your physicians. Otherwise, they have any incentive to change their practice. So try to do it as soon as possible, because you have a proper moment now. This is my advice. I would like to tell you how to speak to your physician. This is a tricky question. When you're coming saying, yeah, I use it for many years and you should prescribe me, it's not enough. Your doctor just do not believe you. You should understand what his knowledge in this field. Sometimes, and in majority of the cases, you have much better knowledge than your doctor. So you should educate your doctor. You should explain him that you are not, recreational episodical user, but you are using your medicine for particular symptoms. And it should not be done only for particular diseases. Just describe the symptoms that you have cannabis to alleviate them, and explain it clearly to your doctor. And I hope that honest physicians will learn from you and will collaborate with you. This is why I accepted it. And when I listen carefully to my patients, post-traumatic patients, Tourette disorder, I learned from them that they really helped by the cannabis. I didn't believe them. For first 2-3 patients, I just did not believe. It was very hard to me. I should be very honest with you. It is very hard to change the basic attitudes when you rise as a physician. And a physician in the auditory, I suppose, it is very familiar sense when you open to new knowledge, new field. I suppose we should be honest with our patients, to listen to them carefully in order to try to learn from them and to see a common way to provide them better treatment. And not to say, okay, you are just to want to cover your bad habit. No, it's not enough. In majority of cases, it's just wrong. You should know what you could not expect from your physician. Sometimes I have a telephone call. Okay, you are a cannabis physician, yes. How you could supply me 20 grams of cannabis? So I suppose it's just a joke in the best way, because there are some roles we could not play, and you should not expect from us to do such position, because we have some regulations in an ethical code. So you could not expect from us to deliver physically marijuana to you. I have never possessed marijuana in my clinic because I'm not allowed to have any access to it, just to discuss it, to provide some material and information. So first of all, we doctors need to educate ourselves in order to speak with our patients on the same language. Otherwise, it will be a waste of time. Also, we should discuss with our patients the topics, what the proper way of administration, because the easiest way is smoking. But nobody said that it is the best way. It doesn't fit for anybody, for everybody. There are about 18 different ways of administration of cannabinoids, and all of them should be discussed with the patients. And probably they will change their practice. I have many patients that use the cannabis as a smoked agent, and now they use it as a suppository, as in vaporizers. So they know that some way it could be harmful for them. Of course, this is probably a safe medication, but you should explain to patients there is other ways how to use it. And they should have access to all this way, because in Israel we have all this administration form available. But people should be educated on this, and doctor and patients, and their relatives. When I have a new patient and he said, okay, I would like to have a license, my second question is, okay, is your family support you? What is the attitude of your family? You should have the family around you, supportive you in this way. Otherwise, it will be in vain. The people, and I invite them to come to my clinic to consultation with family members. And if there is no consensus within family, I am asking, who is against? Who is against? Bring me this person. I would like to speak with them. This is, I suppose, the best way to know what they believe, what they prejudices have toward the cannabis. We should discuss it openly in our clinic. Otherwise, the patient would have a bad advice and bad treatment in their house. I suppose that the case of Lucy, when the very careful mother just support your son, is the best example how the family should relate to the family member, and carefully and responsible. And I suppose this is the best example I'm going to use this example in my practice, saying, see, the family was just together in order to deliver to their son a better kind of treatment. And I really appreciate all these efforts. And it is, it's personal disclosure. It's very difficult to do. And this is why I appreciate it so far. Also, we should speak openly with the families and patients. And we should be maximally objective. I do not believe that cannabis could be standalone treatment. I am ready to discuss it with somebody who suggests if I am taking cannabis, it is a medicine by itself. I'm not sure on this. I suppose it should be a part of the treatment plan. For example, for rehabilitation of, I have patients with brain injury. I frequently use CBD contained substance for them. It is very good medicine for them, but they also have another rehabilitation plan. I'm not alone. I'm not working alone. I'm working with occupational therapists, speech therapy, and other workers. And together, with cannabinoid medicine, we have a real progress. I suppose that we as the doctors now in the very shaky position because we are now serving as the gatekeepers. And I suppose the situation should be changed. And in your country, when you are beginning to build a new system of cannabinoid medicine, you should learn from our mistakes. So this is why it is important to have such meetings, and I suppose it will be much more meetings further next years, because you should put together and policymakers, doctors, industry representatives, everybody who has identifiable interests in this field, and you should put them together and provide them an opportunity to have a dialogue. Otherwise, it will go into the wrong direction. What my suggestion? What should be done? First, what should be done? First, it should be stopped to demonize cannabis in all over the world. It should be stop brainwashing to students, residents, and doctors. First of all, we should change the quality of medical education toward the cannabis in the medical schools. Otherwise, nothing will change. You should begin from this. The curriculum for the doctors, nurses, and pharmacists should be changed as soon as possible. It did not happen in Israel for the last 6 years. Instead of all my efforts to provide a medical course for the doctors, doctors just do not want to participate in it. Our Ministry of Health supposed me to have this course in Israel. It was announced for all Israeli physicians who are responsible for cannabis prescription. And only one of 30 doctors had his will to participate in this course. Doctors are a very reluctant community. They just do not want to be educated in this way until we will change an attitudes. Since very beginning of medical education, you will not have any progress of inventing cannabis as a treatment substance. No way. Just begin from the doctors and nurses education from very beginning. Moreover, we should have a network of physicians in each country that could have a possibility to exchange knowledge, skills, and information between them. This is why it's very important to establish and patient advocacy organization and doctor advocacy organization. My role as a coordinator of Israel Forum for Medical Cannabis is very limited. I have about 150 physicians that currently prescribing cannabis for all this huge amount of the patients. In Israel we have about 20,000 physicians, and only 150 of them are prescribing cannabis. It is an impossible situation. And this is our forum, virtual forum, Israel Association. It's just virtual forum of the doctors that we have an exchange of information between us. It should be changed in Israel, where the cannabis is allowed as a medical substance. And sure, should be changed in your country. You have a much larger country and much more doctors are involved. But try to educate them, to provide them objective knowledge, unbiased. Also, I'm here on the behalf of International Association of Cannabinoid Medicine. And I invite all medical professionals. This is association is open for medical professionals, healthcare professionals, pharmacists, scientists in the field of medical cannabis. I invite you to visit frequently our website. This is a free website for everybody. And I invite to be members, medical professionals and scientists working in this field. Just you are welcome to see our site and to obtain very recently updated information from all over the world. I would like to finalize my talk again with a site of Professor Lester Ginsburg. We had an honor to have his presentation before me, saying that over the last decades and a half, I have come to believe that there is a third category of marijuana use, enhancement. So he is saying about the quality of life. We are physicians just learn not to appreciate the quality of life. The cannabis allow our patient to have a better quality of life without any kind of limitations and indications. Please try to provide to your patients better treatment and put in the corner the quality of their life. I suppose this is the best way you could provide the better treatment to your patients. Thank you for your invitation. And also I would like to show you in this particular moment, and if I have 2 minutes, I would like to, on this occasion, to show you one paper. I just, yesterday I found the paper, I was not aware about it, that published 1 year ago, describing the situation in your country, in your particular New South Wales, saying that now you have a particular moment to change the current practice. You should use it. The doctors who wrote this paper, they reviewed it wonderfully. You could obtain it free from the web and to download. It's free, and I would like to cite them from the conclusions. In Australia, medicinal cannabis currently has strong community support. About 70% of the population are voted for cannabis. There is certainly more to learn about medical cannabis. And I would like to finish my talk with saying, all scientific knowledge is incomplete. What does not confer us a freedom to ignore the knowledge we already have, or to postpone the action that it appears to demand? I suppose that the best emphasize the current situation and the changes should be needed. Thank you very much.